in Madison, UW Health is running out of vaccines and has just less than 100 in its stockpile. They're ultimately having to turn people away who had a scheduled appointment. So let's talk more about that with Dr. Jeffrey Pothof with UW Health. He joins us now. So are you surprised you're in this situation, and what is the impact on those who are seeking their first and, more importantly, wanting their second?
Yeah, I think, we knew that vaccines were in short supply, and it's true that we need to get some more vaccine to the state. As far as patients, as disappointing as it is for us, we're sure that it's even more disappointing to our patients who will get notified this week that their vaccination appointment is going to need to be postponed because we just don't have doses that we can give them. I think it's important to note that folks who have already had their first shot, we do feel very confident that we will get them their second shot, so they won't miss that. But all in all, things aren't perfect as it goes to vaccine distribution. We have to do a little bit better job.
So you say do a little bit better job. Is that at the state level, the federal level, a combination?
I think it's a combination. I mean, no question, we just need more doses coming to the state. And I think, at UW Health, we're looking forward to working with DHS on our shared goal of getting the state vaccinated. And the more we work together on that, I think the better the people of the state do.
You said you're going to have enough for the people who need the second dose, but is it a timely issue for those who are waiting for that second if they run into this situation?
Yeah, for the most part, if you've gotten your first dose, we're able to guarantee that that second dose will be available. What we don't want to have happen is someone get the first dose and then not be able to finish that vaccination series. Where we're struggling the most is with those first time appointments, where we have close to 29,000 of them scheduled. But as of 9 o'clock this morning, only had 93 doses of vaccine. Obviously those numbers just don't add up, and we'll need to postpone some of those vaccinations that we were planning on doing this week as we wait for our stocks to replenish a little bit.
Dr. Pothof, are you running into the situation where at the end of the day you might have 5, 6, 7 shots available, doses, and no one to give them to? And what's happening in that situation?
Yeah, I think this is an important thing that all vaccinators are dealing with. So our process has been, we have basically an on-call list that is open to those who are age 65 and above. As of just a couple of days ago, there's tens of thousands of people that are on that list that are available to come in for a vaccine appointment on very short notice, an hour or less. So when we have a vaccine dose that's available at the end of the day because of a cancellation or for whatever reason, we are able then to identify someone in the correct category of 1B that we can get that vaccination to. So one, it doesn't go to waste, or two, we don't give it to someone who maybe doesn't fit the right risk profile.
Just a quick question out of curiosity. Which vaccine are you offering, and do people have a preference on brand?
Yeah, I haven't seen any preference on brand. For the most part at UW Health, we've been working with the Pfizer vaccine, likely because we do have the ultra cold storage available at our facilities that makes that just a little bit easier for us. But certainly if Moderna were available, we'd be happy to take that too. The side effect profile is about the same, and so far we haven't been hearing a big preference from patients on which one they'd like to get.
Yeah, I'm curious if that will change when J&J comes out with theirs, which supposedly just has the one shot. We'll talk more about that next time. Thank you for your time.